After lameness, respiratory diseases are the most common condition affecting horses. Even though your horse shows no clinical symptom, its health and fitness can be affected. We at Equine Healthcare recognize the need for an effective device that was above all easy to use. With the help of Animal Health Trust and Dr. David Marlin, we developed the EquineHaler. I will now hand over the device for demonstration.
And the best way to show how to use this device is with a horse. For any stabled horse, whether or not it has respiratory disease, it's important to minimise the amount of dust in its environment as far as possible. This involves using bedding such as paper or good quality shavings, or forage sources such as haylage or soaked hay. So once you've inserted the metered dose inhaler or puffer correctly into the EquineHaler, stand just in front of the horse's shoulder. Slowly place your left hand round over the horse's nose. Again, slowly bring the EquineHaler towards the horse so that the rubber cup fully covers the horse's nostril. Slowly move your left hand down to close the left nostril, and again slowly actuate the metered dose inhaler. Wait for the horse to take 2 breaths. Once the horse has taken 2 breaths, you may then administer the second dose. If you have further doses to do, you may carry on like this, or you can take the metered dose inhaler away from the horse and then bring it back to give further doses. So with minimal practice and following this technique, all horse owners should be able to use the EquineHaler to deliver inhaled medications to the majority of horses in this way, just on their own. To ensure that the correct amount of drug delivered by the puffer goes into the horse's lung, it's important that it is inserted correctly into the EquineHaler. To do this, use a gentle twisting action as you push the metered dose inhaler into the EquineHaler. It should then sit nicely in the rubber seal. When using the puffer, be careful not to tilt it up or down, as this will result in a large amount of drug being deposited on the surface rather than sitting in suspension ready to be breathed in. Remember that you should only use drugs prescribed by your veterinary surgeon and at the stated dose with this device. With difficult horses, it's best to have somebody to hold the animal for you. The first step is to get the horse used to the noise made by the metered dose inhaler. So, making sure it's facing away from you, actuate it near the horse so that the horse can hear the noise. Initially the horse will react, but with repeated actuations the horse should become more used to the noise. The next stage is to introduce the horse to the EquineHaler itself. First do this without the MDI attached. Show the horse the device and slowly and gently introduce it over the nostril. Get the horse used to seeing the device moved onto its nostril and away. Next stage is to actually insert the MDI, but instead of actuating the device on the horse, do it away from the horse to fill the chamber, and then slowly bring it onto the nostril, closing the other nostril with your left hand, as before. After the horse has taken 2 breaths, take the device away, refill the chamber, and bring it back to the nostril. So using this technique, you should be even able to administer this medication with this device to difficult horses.
The EquineHaler is very versatile and can be used with any inhaled medication in an MDI puffer, including steroids and bronchodilators.